This Week in Richmond is made possible in part by Dignity Memorial, caring for our communities with a network of funeral homes and cemeteries in Virginia and throughout North America. More information about Dignity Memorial's providers is online at dignitymemorial.com. The Virginia Chamber of Commerce, the voice of the Virginia business community, working in legislative, regulatory, and political arenas to promote the free enterprise system. Information at vachamber.com. Virginia hospitals and health systems provide jobs. They support our economy and promote public health. Local hospitals are always open to help people with unexpected health needs. Having a stable healthcare network is vital. Virginia hospitals are our lifeline.
It's amazing what my students with special needs can accomplish. Their pride is priceless. That's why I teach.
Brought to you by the Virginia Education Association, because a good education is good for everybody.
Additional support is provided by these sponsors. And by the members of Virginia's public television stations. Thank you.
Welcome to This Week in Richmond, and a very special welcome back to Dr. Bill Hazel, Secretary of Health and Human Resources. I say Dr. Bill instead of William because that's what folks know. We're talking here as the General Assembly has convened, and there are hot issues in your secretariat that are before the General Assembly, and would appreciate your laying those out to our viewers. Some of them they've seen on the front pages of their paper, and others have been second, third page. They're hot issues, important issues.
Well, when my secretariat makes the news, it's generally because there's a problem.
Right. But this time not. Yeah.
Well, I think there are problems, but we're solving them.
Right.
I think the big things that we're looking into the session for are some thoughts on how we improve our system of mental health.
Yes.
And
right.
a piece of that, it's not the same but related, is what we do with people who are addicted and how we deal with the addiction crisis. Right. And I think if we look over the last couple of years, clearly our mental health system, such as it is not functioning as we'd like it to. And there are components to it. There are the community services in the public sector. There are the jails, and I think it surprises people how large a component of the mental health system jails really are.
Yes.
They're the state hospitals, and then you really have to realize that there's still a private world out there too, with the physicians and the psychiatrists and psychologists and so forth, and none of these really are organized to align.
Right.
And I think we have to get to that, and that'll be a big piece of it this session.
We were talking even before we started the show about the challenge of getting it all organized that way, because
right.
there are those important pieces that are, I suppose at times, not working at odds with each other, but not really cooperating.
Well, let's think just a simple example. We know about the jail deaths, right?
Yes.
And if we take the Mitchell case in Hampton Roads, for instance, as a specific, the first question is, why was this young man in jail?
Yeah.
Why would not have been better for him and for society to have had some treatment in the community, a PACT team, something to ensure that he got whatever medication that he needed? Perhaps he didn't need to be in jail. And then when he got to jail, the interaction between the jails and the courts and the hospitals obviously didn't go the way it should have gone. And so that's just the tip of the iceberg there. But little things that demonstrate that we don't actually have a functioning system. For instance, it is not uncommon for a jail to send a patient to a state hospital for evaluation, stabilization. They get put on medication, and now it's time to go back. And guess what happens? The medication changes because it's not even on the formulary. So why did we do that? Why did we do that? So the idea that we have a system with some common goals, measurements, some common medications, some treatment that actually makes sense would be enormously helpful. So the governor did put $31+ million in the budget this year, in a tough year, for a number of things related to mental health. One is improving treatment in jails. Another is improving addiction treatment and making it more available, medically assisted treatment for addiction. Another is to strengthen the CSB system. Some money was put in for state hospitals. We're seeing increasing numbers of people and really increasing violence in the population that's coming in. So that's contributing to staff turnover. When your state hospitals are losing employees to the regional jails and to Walmart, there's a problem. So these are all things that we're working at. And additionally, there was some money put in for really a planning process. And people get confused. We have a vision of what we want. We need a system that considers all these components and aligns them. But I think, we were talking about if you're building a house, you need a set of plans.
Right.
And it's one thing to have the sketch, but you've got to figure out what materials you're going to use, where your electrical sockets are going to be, all these things. And so we need to really think through. We have hundreds of millions of dollars going into this system, and to think that we can't and shouldn't take some time and figure out who will do what, how will people communicate, where there will be common protocols, what services will be available in a little more detail, who will provide them, and then how will we staff at the state to oversee it. And all this takes a lot of work that we're going to need some help with if we're going to make this work.
Talk a bit more, too, about the addiction problems that there are in the Commonwealth and what's foreseen to try to do something about that, too, in addition to what you were saying.
Well, obviously, the addiction problem has gotten a lot of attention because of the deaths. And this year we'll probably have over 1,100 deaths related to opiates. And as you think about this and you go back a few years, there were pills, and then there's heroin, and then the heroin is laced with fentanyl, which makes it more dangerous. And now we have we had 2 deaths with something called fentanyl recently.
What was that again?
Fentanyl. It's an elephant tranquilizer. They use it in veterinary surgery for elephants. And we've had, when people get this and don't know, I mean, they can die from it. In fact, one of our law enforcement problems is when you have an unknown substance. If an officer comes and is exposed to it, or one of our people in the forensic lab is exposed to it, there's risk to them because it can be absorbed through the skin. So these are very, very powerful substances. And the common thread, though, David, is addiction. And I think that our challenge now is we do have a number of people in Virginia who are addicted. And if we cut off the supply of pills abruptly, they're still addicted. And they go to the street, and that's where the danger is. So we have really probably 5 levels of intervention we're thinking about.
Now you mentioned the 1,100. Is that nationwide?
No, that's Virginia.
That's Virginia.
That's Virginia.
Well, I wanted to clarify that because that's a huge number for the Commonwealth.
Right, and it's changed. A couple of years ago, it was prescription drugs, and then it's heroin, and now it's this fentanyl project, which is really a synthetic opioid, and it is very, very powerful. And when someone who is not used to that level of drug gets it, it shuts down their breathing. They die. And so that's why naloxone has been made available. That's an antidote that reverses. That's harm reduction. And I think the first thing we're looking at is how do you reduce the harm? Until people can get into treatment, how do you reduce the harm? And the harm includes the crime that supports the habits. The leading cause now of kids coming into the foster care system is substance abuse in the family. We had a 21% increase last year in babies who were born addicted, neonatal abstinence syndrome. We have the infectious diseases that go with it, the endocarditis, hepatitis, HIV, and we have somewhat of an epidemic in places of these. So these are all things, and people say, well, it costs so much to treat them, but what we have to recognize is there's tremendous cost to leaving it out there untreated. Who pays for all this? And we all do.
That's what I was wondering, when in a tight budget year, when you talk about, was it 37 million?
31.7.
31 million,
yes.
okay, a little smaller. That some of that money would be, if nothing was spent to do these new programs, there's still going to be those rising costs due to the problems that are being created.
Right, right.
And I think that probably the challenge in the next several weeks as it works through the legislature is everyone seeing that it's, in a way, I guess I'm pitching it, that
Yeah.
in another way, it's not just new money just for other programs, it's money that would save lives and also save some other costs that would be out there if nothing was done.
Well, I think that's the thing. We know, for instance, using medically assisted treatment with Suboxone is going to cost $600 or $700 a month for the course of treatment. What people don't realize is, so you have, what happens over a year with an individual who is addicted? Do they come into contact with law enforcement? Are they unable to work? Are we subsidizing them through benefits? Are social services having to engage in the family? Is the individual in and out of jail? There are costs to this.
Right.
And I saw a study recently that goes back to 2010, but at that point they said that the U.S. was spending about $55 billion for the impact of addiction, independent of the medical costs. $25 billion to treat it, but $55 billion of expenses related to addiction because of the use of the system.
Dr. Bill, we very much appreciate your coming on today and right here near the beginning of the session and laying out these two important issues, and people will be reading about them, they'll be hearing about them, they'll have opportunity to contact their legislators. Until the session ends and the matter's back before the governor, it's in the hands of the 140 members, and they, on these issues as well as others, they are looking to be contacted by their constituents and saying, what do you want us to do?
They are, and you know, we really need to be focused on this area.
Right.
And one thing I would say, David, kind of the last, this won't get solved in one session.
Right.
This is not one and done. We need to stay after this as we go forward if we're going to be successful.
And we've got this mental health study that was started and it's moving forward.
Right.
And this is just what's before us in the 2017 session. So thank you very much, and look forward to getting back with you later in perhaps after the session.
Thank you. Look forward to that.
Thank you. We're delighted on This Week in Richmond to have three experts that you read from two of them. You see one on TV, Alana Austin, NBC 29, Michael Martz, Richmond Times-Dispatch, Travis Fain, Daily Press. I'm not going to take our viewers' time to give all of your history and what you've been doing, or they've been getting the notice that the time is up. I'd rather you take the time to tell our viewers, what are you already seeing in the first week of the session of some of the issues that you think are going to be the hot issues, maybe the hot for the first half, or maybe the hot issues all the way through February and even into reconvene day. So I don't know who wants to start. Michael, I'm going to ask you to start. You're the dean of the three, and you start, and others, and feed off of each other. If you ignore me, I'll just let people know when the show's over.
The budget, the budget
Right.
is what I do, rather than so much of the individual bills. And the budget this year is really dominated by the loss of the 3% raise because of the shortfall, projected shortfall. I think there's still some hope that revenues will recover. There was a modest loss in revenues in December. We'll see how much in February, how much money they'll actually have to play with. But you already see it dominating some of the early discussions with the money committees. Even before the session began, one of the Senate subcommittees let Secretary of Public Safety Brian Moran, the other Moran, know that he was going to have to give up some of his money for new initiatives for state police. Whether that happens or not, I don't know, but the message was sent.
Yeah, and I think some of that money was for mental health things that they want to do in the jails. That movie's going to move around. Money's going to move around, but it's going to be there at the end of the day. Emmett Hanger, who co-chairs Senate Finance, said after the governor's speech the other night he wants more money for housing to help people get out of mental health hospitals, rent support so that they can kind of live in the community. That's something that bubbled out of the Deeds Commission, and I think they put a $10 million figure on it, and the governor didn't have near that much. So look for that money to increase. A lot of these big issues, as you say, are going to dovetail with the budget, including mental health.
And then, of course, there's also the question about state pay raises were taken off of the table, the 3% bump in the pay, but there has been a bit of a crisis at state police. Colonel Steve Flaherty has said that they're just hemorrhaging members of the force, that there's a salary compression issue, that the starting pay is around $36,000 a year for these state troopers. They're heading to other states, and so there's obviously certainly limited resources, but I think there's a bipartisan consensus that something has to be done to make sure that they have the public safety revenues taken care of.
It's an interesting dynamic because we have the legislature, including conservative Republicans, on Speaker Howell's retirement and Employment Security Commission saying restoring the pay raise is their top priority, and then the governor comes out the next day with a bonus, a one-time bonus that state employees are not impressed. It does not impress state employees or legislators. That was DOA, and I think they're going to look for money to at least address the problem spots. In addition to state police and sheriffs, they're going to hit mental hospitals have huge turnover with nurses and direct care staff, prisons. The toughest jobs in the state have the highest turnover, understandably, and I think that this commission has been very focused on the potential turnover in the state workforce, and they're going to do something, and the governor will then take credit for it.
Yeah, Chris Jones has been sitting in the back of all these mental health commission meetings. He's the appropriations chairman, of course, and he's made it clear. I mean, you can see him taking notes, and you can see him calculating the numbers in his head. So it's absolutely going to be a priority.
So the ones that fall below the threshold of the budget, and there's some, but like you say, many of them are tied in to the budget. So what would be some others then and maybe ones that are not getting that much attention?
It's so early. A lot of them aren't getting a lot of attention. Senator Mamie Locke has a few bills that deal with police officers. She wants departments, if an officer gets fired or produces a civil suit over some sort of interaction with a citizen, a shooting or some where something goes wrong, she wants that information shared with other departments more freely. On the other side of it, Jackson Miller, who's a former police officer in the House, he has a bill that would keep police officer names secret under penalty of law if you release it during the investigation into a shooting or for 6 months, whichever is the shorter period of time. And it's a longer bill than that. It does a few other things. But so that's a debate that I don't know that that's ripe. I don't know that we're going to see actual movement on that, but I think you'll see the debate get going on that, and that can obviously be an issue where a lot of passion comes out.
Right.
So look for that to emerge a little bit.
Yeah.
What about the Virginia Economic Development Partnership? Leading up to session, of course, the Joint Legislative Audit and Review Commission had a scathing report about how things are run there. So there's new leadership coming in, and Republican lawmakers in particular were concerned with the Appomattox deal that didn't materialize. So more accountability, more control measures to make sure, hey, the state is spending millions of dollars on economic development. They want to have an incentive for these companies to come here, to invest, to hire workers, but they also have to make sure that these businesses are coming through. So I think, what do you all imagine? That might be a discussion?
It's a huge discussion, but it's laced with politics because you have the sort of, I don't know if you could call Ed Gillespie the Republican frontrunner for governor, but he's certainly acting a little bit like a governor-elect and trying to sort of dictate to the legislature what he thinks they should do on economic development and employee pay. He actually favors restoring the pay raise if possible. And it's going to be an interesting debate. The Republicans, of course, are trying to make this issues of VEDP. The McAuliffe Northam, Ralph Northam, the presumed Democratic nominee for governor, their sole responsibility, when the governor correctly pointed out this is 21 years under a Republican governor, George Allen, in 1995, 5 governors, 21 General Assembly sessions. Bob McDonnell put out as many press releases as Terry McAuliffe on economic development deals. Right. So there's a lot of politics. There's also, but there are very serious issues involved in terms of what approach the state should take, and that gets back to the budget again. Sorry to bring it back up, but it's $50 billion a year. There's all the money for Go Virginia. The Republican legislature's preferred approach to economic development. The governor cut $15 million out of their budget, so we'll see what happens.
And the biotech money for up in Northern Virginia on the campus there. Right. That's kind of all that kind of. And one thing that might hit people in the pocketbooks is going back to the state police. Bill Carrico in the Senate has a bill that would increase $1.25 every year. Is it driver's license renewal, or is it your
registration?
Your registration. So we always talk about, well, there won't be any tax increases to balance the budget, but it is possible you could see a fee increase to help state police. It would be specifically earmarked, although that could change. That died last year, but I'm hearing that the House of Delegates is a little more acceptance, maybe not enough to pass it.
In an election year?
People love cops. Yeah, I mean,
they don't like fee increases in an election year.
No, but do they notice them? I mean, that's the question. That's the calculus that everybody has to ask themselves. We'll see. It may die on the vine, but it just depends on where revenue numbers are. If they can give the raise without it, certainly I think they will. But I mean, every month those numbers come in, and it's
state police is going to get money in the budget. I don't think there's any question about that. I mean, the governor has done the legislators a favor by identifying $130-some million for his bonus package and other things, and they're going to say, okay, thank you very much. We'll put it where we want to put it, and that's the game, and it'll go right through the veto session in April, and we'll see how it all ends out.
Yeah, could very well looking way ahead, could make for a very interesting veto session.
Either that, or the revenues will recover in mid-February, and everybody will go home happy.
Yes.
It seems like these holes always get filled.
They did 2 years ago.
Like without the dire needs that they start out with.
Okay, the last couple of minutes. Alana, what's one other issue you want to mention? And then Michael.
Well,
Travis.
It has been a big talker for right now. Of course, the North Carolina-style bathroom bill. There was just a major press conference in the state capitol this week. Republicans, social conservatives are calling for a bill that would have in government-run facilities, so your public schools, your restrooms off of the highways, making sure that people are regulated in a way so that the gender that you're born with, you're not supposed to go in the opposite sex's restroom. There's also a provision that went further than North Carolina in saying that parents need to be notified within 24 hours if their child is at the school, now saying they want to be recognized by a different gender. So I don't think that this is necessarily going to, certainly very little chance of it taking effect this year, given that the Democratic governor feels very strongly about this. He feels that it is an anti-LGBT measure. He's passionately said he would veto it, but you never know down the road with a new administration, if a Republican were to be elected in the governor's race, and then there's a Republican majority General Assembly. I guess it's kind of a wait and see. But sometimes I think these discussions sort of bubble over for a year or two, and then sort of we'll see what happens.
I think it will be interesting to see what happens with health care, if anything, during this session. Obviously, the vote in the U.S. Senate the other night to repeal the Affordable Care Act, regardless of whether they have a replacement, is going to have an effect here. I think Kathy Byron has a bill that would roll back the state insurance laws that were changed a few years ago to give the SEC and the Bureau of Insurance authority to administer these health plans on the exchange. So we'll see. I think that's going to, Washington is going to cast a shadow over Richmond.
Last 20 seconds, Travis.
That's a wonderful point. I'll do another police bill. Joanne Ward in Hampton has a bill that would include in the driver's education courses kids take how to deal with police, what to do when you're pulled over, so that everybody knows what should happen and things don't go wrong. Seems like a kind of common sense.
Thanks to the three of you. The viewers will be reading and seeing and following your issues. Thank you for being on This Week in Richmond.
Thank you.
Thank you.
This Week in Richmond is made possible in part by Dignity Memorial, caring for our communities with a network of funeral homes and cemeteries in Virginia and throughout North America. More information about Dignity Memorial's providers is online at dignitymemorial.com. The Virginia Chamber of Commerce, the voice of the Virginia business community. For jobs, the economy, and public health, Virginia Hospitals, our lifeline.
The Virginia Education Association, because a good education is good for everybody.
Additional support is provided by these sponsors. And by the members of Virginia's public television stations. Thank you.